live with Dr. Rachel Rubin, urologist and sexual medicine specialist. Dr. Rubin, thank you so much for joining us today.
This is so fun. It's my first YouTube live. I'm excited.
Yes, and we have questions from the YouTube community that came rolling in as soon as they found out that you were going to be here to address some of their pelvic and sexual health questions. So let's dive right in.
Let's do it.
Let's do it. So the first question that came in was, what is a crygasm and why does this happen to some men?
Ooh, it happens to women too. So, orgasm is really a big open space of us not knowing anything in medicine and science. There's so many questions that we have about orgasm. And honestly, orgasm is a neurological event. It is like this buildup and release of this magical pleasure that can happen, but it can lead, you can have pain with it. You can have crazy side effects after it. You can have all sorts of things happen. It's a biological event, sort of just like anything else. And so all sorts of wacky biological things can happen. Crygasms, if you will, like again, that release, of tension for some people is a really sort of emotional event
Mhm.
and can lead to laughter, can lead to crying. We sometimes can see headaches. We can see all sorts of things. And I won't say we fully understand the science behind it, but it's not, I don't know that it's always sort of a psychosocial mental health issue, although that certainly can play a role too. But it's a very interesting biological process that we don't fully understand.
Right. Well, thank you so much for unpacking that a little bit for us. All right, we got the next question. Phimosis. What is it and any tips for someone who has it?
I like that you said tips there. I'll take the pun. So
I did
you,
not
you
intend
did
that to be
that.
a
So,
pun.
okay. So I'm wearing sleeves, which is really good. Hopefully you can all see my sleeves. So when you have a foreskin, right, or we call a prepuce, now clitorises have them and penises can have them. And then an erection happens, right? It should sort of pop out and you should see sort of the whole head of the clitoris or the penis. What can happen is sometimes this foreskin or prepuce can get stuck. And so it can get stuck sort of just a little bit and be a little uncomfortable, or it can get stuck like a lot and like be
Mhm,
totally stuck. So you get an erection and it cannot pop out. And that can cause pain. It can cause pain
mhm,
with arousal, either a clitoral arousal or penile arousal. It can cause discomfort, irritation. Some of our patients say, "Ooh, it feels like I have an eyelash in my eye. It's really irritating me."
mhm,
And so there are things that you can do. Sometimes we do things like stretching maneuvers and steroid creams. Sometimes we do procedures to get rid of the adhesions or to stretch
mhm,
things open. Some people do get adult circumcisions and things like that. Now, I'm not here to talk about the politics of all of that, but
mhm.
just talking about pain and discomfort and inflammation can happen because if it's stuck, a lot of smegma, oils, and skin cells can build up underneath, which can really irritate and inflame the area.
Mm,
But happens, it can happen to all genders.
absolutely. I'm so glad that you brought in bodies with clitorises and that there's so many more similarities than there are differences when it comes to our genitals. I just want to say that I so appreciate the bridging in the two anatomies of like, hey, erections happen to clitorises, erections happen to penises.
Literally the same thing.
Literally the same thing, exactly. So let's go on to the third question about prostate massagers. Are they good for prostate health? Are they recommended? And what does the evidence say? I love that. What you got there, Dr. Rubin?
This is called a multo. I like this device because actually, for female pelvic floor, like it really is nice for a pelvic floor through a vagina or pelvic floor through a rectum. I think it can be really helpful. So, looking for more fun things. Okay, so it's really important that your pelvis is a bowl of muscle, and we're on Susie Gronsky's channel, so you guys know y'all know everything about the pelvic floor. Thank goodness, and I have a lot to learn myself. But really, the best way to activate this bowl of muscles can be sort of through the rectum, because there's really only one hole that can kind of get you there. And so prostate massagers can be useful for a number of different reasons. So the prostate itself has a lot of nerves all around it that can be extremely pleasurable. And in a way, actually, the G spot in a female pelvis is often thought to be the equivalent to a male prostate. So some vaginas like anterior vaginal wall stimulation, some
Mhm.
prostates like stimulation. So if you like it, that's awesome. Lean into it. If you don't like it, you're normal. It's okay to not like it too.
Thank you.
If you want
Mhm.
to try, play. Like this is all about play and
Mhm.
fun. And some people like skydiving, and I would never do skydiving. Like that's okay, right? So the other thing where prostate massage can be really helpful is that there's a lot of muscles and tension that can build up in these muscles. And so releasing that, just like you may get a massage for your neck up here, it may
Mhm.
help you sort of with different pelvic floor symptoms. So it can be therapeutic as well. And what's nice about some of these devices is that you don't have to necessarily go to the someone to help you with it, but you can actually do it at home yourself, which is so awesome. So here's just an example of a device. If you're ever going to put anything into your rectum, full
Mhm.
disclosure, it needs a wide base. We do not want things getting stuck up there. It can be a real suction tube, and things can get lost. And you don't want to go to the ER because it's not fun to be that person at the ER with that problem. So make
Right.
sure it has a wide base. And this one vibrates, which I think is very nice. And this is a company called Mystery Vibe. I'm a big fan of this Multa. So,
Yes, big shout out actually to Mystery Bite for being one of our sponsors, our
oh
silver
yay!
sponsors for the Men's Online Pelvic and Sexual Health Summit, which Dr. Rubin is a speaker for, who is going to be talking about post-finasteride syndrome. Please check it out. Learn more at sexualhealthsummits.com. If you haven't gotten your tickets, get them now before prices go up.
Yay, I love that. No, I'm glad they're sponsoring. I love that they have devices for everybody, and also they really think about pelvic dysfunction as well with their devices. It's pleasure, yes, but they also understand sort of the medicine, which is really cool.
Absolutely, absolutely. So as far as if someone doesn't do prostate massage, like are they doomed? Are they doomed as far as their prostate health in medically?
No, there's no data to support that.
Okay. Thank you. That's what I thought. I just wanted to put it out there. Very good. Let's talk about medications and retrograde ejaculation. There's a question that came in about, does levothyroxine cause retrograde ejaculation? This person has, they said underactive thyroid, or I'm assuming hypothyroidism.
I've never seen that reported on. When I have patients who get weird and wacky symptoms and things like that, I never discount it. It's your lived experience, and anything is possible. The body is a wackadoodle computer that we fully don't understand. And so all medications can all cause things, and we don't, I haven't heard of that one being the case, but one easy thing is to try going off of it and going back on it and see if you still have the problem. Now, there
Mhm.
are medications that we know can cause retrograde ejaculation, often the alpha blockers used for enlarged prostates. So your Flomaxes and Euro Rapaflows and things like
Mhm.
that, your Oxytrol, those medicines can cause retrograde ejaculation. And if you've
Mhm.
ever had a prostate procedure like a TERP or there are different procedures for enlarged prostates that can definitely give retrograde ejaculation.
Right. Absolutely. What about, so we're switching a little bit to estrogen therapy or hormone therapy. And this question came in that said, DHEA suppositories. Is there evidence to support their use in helping with vulvovaginal tissue if estrogen cream is not tolerated?
Absolutely. There's data, and I love this data. So, the vulva, I love that we're switching from different genitals. The vulva is rich in both estrogen receptors and testosterone receptors. It needs both. And so, often just giving vaginal estrogen is enough for many people, but sometimes it is not enough. And I love DHEA because it is an androgen, and you put it in the vagina and it converts to estrogen and testosterone. And so, what is nice is that there is some data, not a huge amount, but some data to
Mhm.
show that it can help with vestibular symptoms or symptoms at the opening of the vulva. So if you find that vaginal estrogen is not working or not enough for you, you may want to switch to that vaginal DHEA. And big shout out to
Mm.
our YouTube channel. If you want to, guys, want to subscribe to our YouTube channel too, is we have a whole series just on vaginal hormones, and we're trying really hard to answer every question we can find about it, so that you can go to your doctor and say, hey, like, what do you think about this very short video by this very smart doctor in the Washington, D.C. area? Can you watch this for me?
That's awesome. Thank you so much. And yes, check out Dr. Rachel Rubin's YouTube channel. Essentially, the handle is at Dr. Rachel Rubin.
Mhm.
Awesome. Very good. Okay, so we have another question. Actually, I'm going to go through the live. We have several people here joining us. Thank you so much for being here. We are so appreciative of you as well. Dominic had asked about crygasms. Dominic, we already addressed that earlier in our interview, so please be sure to watch the recording after we're done here. This question comes in from Chase. What to do for icy bladder pain syndrome?
So I find the term icy bladder pain syndrome a little bit unhelpful, to be honest, and not everyone will agree with me. I'll be controversial here for a second. To just say your bladder hurts, there are a lot of things that exist around your bladder, and so to just blame the bladder to me seems a little bit aggressive. And sometimes we jump to it too quickly to say that all pain is bladder pain or something called interstitial cystitis, which is just not helpful. It's like saying you have back pain without the understanding of it. Is it your neck pain? Is it your lower back? Is it a disc? Is it a muscle problem?
Mhm.
What's causing that pain? And so I always kind of push back a little bit at these IC bladder pain diagnoses because I don't find them particularly helpful. So the real question is like, what, because not everybody who has bladder pain or pain down there has the same thing and needs the same exercises. So actually, you can answer this, Gronsky, is like, there's not like an exercise that's like everybody with pain down there should
Right.
do this one exercise. If it were that easy, we could all just be on YouTube all the time and you wouldn't need Susie Gronsky. What do you have to say to that?
Totally. I'm 100% in agreement with you, Dr. Rubin. Like there isn't just one size magic bullet for bladder pain. As you're saying, the body is an ecosystem. So there's multiple different systems that might be involved in that person's experience of pain. And we really also can't forget about the psychosocial factors and the social determinants of health and resources and access to care and community and support and all the things contextually that can potentially sensitize pain and make our nervous system really crabby. So we have to really look at this from a whole person perspective. And then also have, pelvic floor muscles communicate. They have sensory fibers, motor fibers, as far as the nervous system goes, and autonomic fibers that communicate with the bladder that sit right in this bowl of the pelvis. So we have to address this comprehensively and multifactorially. And really, research is telling us that a multimodal treatment approach with an interdisciplinary care team is the best approach.
Can we put both of our models on the same screen so that we can have little matchy models? Someone take a screenshot. You gotta send me a screenshot of this, okay?
I don't know how I do that. Oh, maybe afterwards with the recording. I
Afterwards, we're
will.
gonna take a
I promise.
screenshot.
I promise.
Yeah.
I promise. Awesome. Okay, let's see. We have we'll be here just for a few more minutes. Let's see. Hi from Colorado. Hello, Edward. And Rick asked, like, what can my pelvic floor therapist and urologist help me with? So maybe
So
what? Yeah. Go
Yeah,
ahead.
so first know that you have a pelvis, right? And so if you have urinary problems, pelvic pain issues, constipation issues, sexual health issues, these are things that are medical issues. And so just getting all your information from YouTube, no matter how amazing we are, is probably not the best way to get your medical advice. But if you have issues that you care about and you want to see a professional, then yes, urologist and pelvic floor physical therapist is like this dream team. Add a mental health professional and you've
Yeah.
really got the trifecta, because it really is biopsychosocial. And so there's so much that can be helped in those areas.
Absolutely. And from a pelvic floor physical therapy perspective, certainly addressing nerves, muscles, communication between nerves and muscles, addressing constipation and pain, especially, and also sexuality counseling. So I'm a sexuality counselor and educator, so I have that certification and education knowledge, and I love to blend the two with pelvic therapy because we need to be talking about sexy feelings and sexy times, and not making things so sterile and medical and trying to bridge the gap between that and like experiencing pleasure. So I love combining both of those when we're doing our work together. Cool beans. Okay, let's see. Let's do one more question. I have a tight scrotum for months. There's no pain, no swelling. Urology has ruled out kidney stones through CT and MRI. What could cause this?
From a tight scrotum, I'll let you take this one, Gronsky.
I thought you might do that. Okay. Well, I'm going to have to I'm gonna have to get my own model here. Hold on a second. I'm gonna take you guys with me. Do 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 do. So I can get my penis
Too
pelvis
many, too
model.
many,
Woo!
too
Oh
many
goodness.
crunches. Could it
Too
be
many crunches.
too many crunches?
Potentially. So here's the thing about scrotums. The cremaster muscle, the muscle that elevates the scrotum and relaxes the scrotum, is supplied by nerves that come from your back, L1, L2, and some variation of L3. But you also have nerves that supply the sensory aspect of the scrotum that come from the pudendal nerve, S2, 3, and 4, which are called the posterior scrotal nerves. And those nerves also communicate with the scrotum. But here's the thing that most people don't know about the connection between the cremaster muscle and your abdominal muscles. The cremaster muscle is the same muscle as your internal oblique. So your lower belly, your abdomen, and having tension in that area habitually, posturally, etc., doing too many crunches and maybe not having variety in how you're doing that and relaxing the muscle can actually cause the scrotum to habitually feel tense. And because there's a lot of autonomic nerve innervation in this area, guess what? If you're stressed, if you're nervous, if you have sexy feelings, any of those things that can amplify the nervous system is going to increase tone within the pelvic floor. So you want to make sure you're checking all aspects, not just obviously the red flags, which are great, but pelvic therapy can be very helpful for relaxing scrotal tension.
Can you make that a clip of a video so that I can put it on my Instagram? Because that was all of it. That was knowledge. That was teaching people things that they don't know, and that was awesome.
Well, thank you so much. Cool. Well, Dr. Rubin, thanks so much for joining us. And I apologize to everyone who put their questions in. We only had a brief amount of time with Dr. Rubin. She is a busy lady and helping people, vulvas, penises, vaginas. Thank you so much for all the work that you do
Yeah, everyone sign
for
up for
us.
our newsletter at rachelrubinmd.com. Follow us on social media. Thank you so much for having me.
Absolutely. Thank you so much. Bye, Dr. Rubin.